Good afternoon and good morning. This is the 1660th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NEHA KOTHADIYA. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and from 9:30 to 10:30 we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again, and you can subscribe the same without paying any money, as well as you can share it with your friends, not only with homeopathic doctors, but also with homeopathic lovers too. And the purpose of this forum is to take homeopathy to every household around the world, as well as connect between doctors around homeopathic doctors and students around the world. And let me come to today's guest. As you all know, today is Dr. NEHA KOTHADIYA MD, Assistant Professor, Department of Veterinary Medica, B.G. Gayaria Homeopathic Medical College, Rajkot, Gujarat, is our guest. And today, Doctor will be talking about usefulness of Indian homeopathic medicines. It's a very, very important subject and very good subject, because she has presented some other papers in this forum earlier, but this one, everyone is looking forward to see what are the medicine that you are going to cover in this session. Welcome, Dr. NEHA KOTHADIYA.
Thank you, sir. Good evening to everyone. Today, my topic for the discussion is usefulness of the Indian homeopathic medicines and mother tongue. As we all know, in India, we have very indigenous drugs. That is very important. What do you mean by indigenous drugs? Indigenous drugs is that drug which is native in India, right? So we can say that the drugs which are produced in the India and cultivated in the India is known as the indigenous drugs. It has been made the use of in its comprehensive sense so as to include within its scope those drugs which are native in India. The history of medicine in India can be traced to the remotest age, traditional medicine or Ayurveda. The science of life is believed to be as old as the Vedas themselves. As we all know that the Ayurveda is the oldest science which given us the very important drugs. From that, we can obtain our homeopathic medicines. Indian homeopathic medicines. History is more important to us. That's why we will go through it. In the former years, Dr. D.N. Ray and P.C. Majmudar came into the field of the drug proving and approved 3 or 4 indigenous drugs of India. Dr. Ghosh discovered and proved 3 new homeopathic medicines, that is Ficus religiosa, Justitia adatoda, from 3 indigenous plants of India, which have since been officially recognized and incorporated with our official pharmacopoeia. In recent times, Dr. Vishwas and Bhattacharya and Bihar have proved several indigenous drugs. How did the homeopathic Indian drugs proving started? Homeopathic drug enriched with the innumerable valuable drugs and doctors. The idea of proving the indigenous drugs of India came to the mind of Dr. S.C. Ghosh in 1887. That is so much important and immense work that took Dr. J.H. Clark took his provings in the Dictionary of the Practical of the Materia Medica. We have also short repertory of the indigenous drug, which is given by Dr. Syed Ahmad. Now, we came to know the medicine that is Ficus religiosa. Ficus religiosa, we all know the people. We all know the people as a holy tree, right? Sanskrit, also known as the Ashwatth. The first prover of this Indian medicine is Dr. S.C. Ghosh. He has given the tremendous work upon this in his book, The Drug of Hindustan by Dr. S.C. Ghosh. The natural order or the family of the people is the Moraceae. Now, what is the importance of the Ayurvedic use of the Ficus religiosa? As we all know, the Ficus religiosa possesses the virtue of the stopping the hemorrhage, any kind of hemorrhage from the any outlet of the body, the ficus religiosa drug is a very useful one. Be it the bowels, be it the stomach, be it the bladder, or the on any other part of the body, Ayurveda used as the to stoppage of the hemorrhages. So as we in the homeopathy, what is the history of the ficus religiosa? Dr. S.C. Ghosh, who made the first proving and thereby discovered its power to cause and cure the hemorrhage of the many kinds. As we all know, the homeopathies belong to the law similia similibus curantia. So what it produces, it will cure. So here the producing power of the ficus religiosa is the hemorrhage. So it will cure the hemorrhage. Dr. Ghosh kindly sent Dr. Clark a supply of the remedy, and he have had a very satisfactory result with the 1x potency in controlling the menorrhagia. The provers were Dr. Ghosh himself, his wife, and a dog. He described all the symptoms in his books very immensely. The dog, which had perfectly strong and healthy, received 40 drops of the tincture one morning, no result the following day, and the dose were repeated the next morning to the dog, and the animal commenced and continued to vomit blood of the bright red color. Hematemesis is seen. It kept very quiet and was unwilling to move. After 3 doses of 5 drops of the tincture given in a quick suction, the vomiting ceased. So the law is proved. Let like be cured by like similibus curantia. What it produce, that is the hematemesis to the dog, and it will cease after the potentization by giving the quick succussion. It is remarkable that the same treatment, the minor dose of the same medicine, was effect in the arresting the effect of the drug in the other two provings, also to himself and his wife. Mrs. Ghosh took the tincture in the 20 drops dose repeatedly throughout the 2 days. On the third day, dysentery and menorrhagia set in simultaneously. The blood was very bright red in the color. The other symptoms were headache, very weak and restless, slight dim, bending the top of the head, the face become yellowish and the breathing is very difficult. She becomes sad and melancholic. With the profuse discharge of the bright red blood, there were bearing down pains in the lower abdomen. So what had effect to Dr. Ghosh? Dr. Ghosh took 40 drops in the one dose. The result was frequent desire to pass water, which gradually became bloody and contained the much blood. The incline to cough, causing him to spit the blood. Slight headache, giddiness, and nausea. Slight dim, very weak and restless. The tincture was taken 3 drops every 2 hours, and after the third dose, the symptoms vanished. Dr. Ghosh related some striking cause cured with the remedy, that is dysentery, hematemesis, hemorrhage of typhoid, bleeding pulse, and epistaxis. Now, what are the clinical which are important to this remedy? Hemorrhagic arrestor, bleeding pulse, epistaxis, dysentery mixed with the blood, hemoptysis, hematemesis, hematuria, menorrhagia, and metorrhagia. Any kind of hemorrhage from the each and every outlet of the body covers by this very specific, wonderful Indian homeopathic medicine, that is hemorrhage arrestor. The second name given to the ficus religiosa is the hemorrhage arrestor. That is bleeding pulse or epistaxis from the nose or a dysentery mixed with the blood or a bleeding with the cough or a bleeding in the vomiting or bleeding in the urine or any abnormal uterine discharge will be covered by this wonderful remedy. Now, what are the other guiding and main important symptoms which this medicine is covering? Mind. As we seen that unwilling to move, sad and melancholic, which is also seen in Mrs. and Mr. Ghosh, very sensitive to noise, oversensitive to the noise, head is melancholic, white, burning at the vertex, vertigo and the slight headache, stomach, nausea, vomiting of the bright red color, pain and sick feeling in the stomach, mouth, white tongue with the profuse saliva. In the nose, it causes the hemorrhage, that causes the epistaxis, respiratory, difficulty in the breathing, cough with the vomiting of the blood, pulse is very weak, stool, bloody dysentery is there, urinary organs, frequent maturation and the blood in the urine. As we all know, here and there, everywhere there is the hemorrhage. In the female reproductive system, menorrhagia, bearing down pain in the lower abdomen. we can prescribe this medicine as the mother tincture 3x, 6x, and 30. Now, let's discuss a case, very interesting case. A female of the 23-year-old came with the complaint of the menometrorrhagia with the irregular periods between the 15 days to 35 days. There is no fixed cycle of her with a very heavy flow, with the excessive weakness. She came in the OPD with the no history of the fibroid, no history of the PCOD. She has all type of reports, but there is no significant cause of the bleeding. But still, there is a very excessive irregular periods which she suffered, and long lasting period is there, which continue till the 10 days, sometimes 15 days, might be appear after the 15 days, might be appear after the 30 or 35 days. So she has given the ficus religiosa, but 30C. 30C was the given to her, and the tremendous result seen. After the 2 to 3 dose, she came down to the regular periods with the moderate flow, and the weakness is completely gone. There is no history of the fibroid, no history of the PCOD, but still there is irregular periods with the heavy flow and with very severe weakness. The patient is said that I'm unwilling to move. There is a history of the menometrorrhagia to her mother. The ficus religiosa 30C with the 3 doses gives the tremendous results. Now the next medicine, Carica papaya folia. As we all know, the Carica papaya, that is the papaya, the fruit which we eat. As we all know, the papaya is the very laxative agent. It relieves the constipation. Common name of the papaya is panpai. The Hindi name of the papaya is papaya. The natural order or the family of the papaya is a Placiferaceae. The first fruit, as we already discussed in the history, that is D&J also conducted the drug proving of the indigenous drugs. The first prover of the Carica papaya is the D&J. What is the use of the Carica papaya? The ripe fruit is very useful in a habitual constipation, dyspepsia, and the bleeding pus. As we all know, the papaya causing the laxative effect to the constipated person, so it is very useful. Which fruit is the ripen? That is relieve the constipation, dyspepsia, any kind of the difficulty in the digestion, and the bleeding pus. Green fruit is a laxative and diuretic. If it is unripened and green, then it is a laxative kind of it will give the laxative kind of effect and also the diuretic kind of effect. Its juice is an amniogogue, aiding the menstrual discharge. In the large dose, it acts as the embolic exciting uterine contraction. If someone consume the papaya in a very large dose, then it will produce the uterine contraction. That's why the papaya, also known as the abortification, it induces the abortion when locally applied to the uterus. As we all know, it is the empirical way to induce the abortion in the history of the India. The remedy has not yet been proved on the healthy human being according to the principle of the Hahnemann, but still its homeopathically preparation is used with the much efficacy in nearly all the diseases and complications. This remedy is a rare remedy. The remedy yet not be proved on a healthy human being according to the principle of the Hahnemann, which will be given in the organon of medicine, but it is still used as a homeopathic disease and the complication of the disease condition. As we all know, the Carica papaya is significantly accelerate the rate of the increase in the platelet count among the patient with the dengue fever and the dengue hemorrhagic fever. We all know that Carica papaya leaves Ayurvedically, the patients take as a platelet count increaser. So homeopathic preparation, also the Carica papaya leaves significantly accelerate the rate of the platelet count, which the person is suffering from the dengue fever and the dengue hemorrhagic fever. There is a protective effect of Carica papaya leaf extract against the alcohol-induced acute gastric damage and blood oxidative stress. Also, the rare use of the Carica papaya is the alcohol-induced acute gastric damage. Acute gastric damage को क्योर करने में Carica papaya का Q जो mother tincture है वो very useful. Sorry, the Carica papaya mother tincture is very useful to cure the acute gastric damage. What are the other clinicals when we use the carica papaya, abortion, dyspepsia, enlarged liver and enlarged spleen, along with the uterine disorder. Why the enlarged liver and why the enlarged spleen? As we all know, the dengue complications. If the dengue persistent and without cure, it will enlarge the liver, splenomegaly and hepatomegaly is there. Okay, that's why it will act on the enlarged liver and enlarged spleen. What are the other guiding symptoms of the carica papaya? Carica papaya, the guiding symptoms mainly affect on the GI tract. So, enlarged liver and spleen. But the most important thing is with the fever. In the dyspepsia, with the weak digestion, undigested stool in the small quantities for a many times a day, with the white-coated tongue and intolerance of the milk. It is a very important symptom of the carica papaya that intolerance of the milk in any kind, cannot tolerate by the patient and vomited out. It promotes the digestion, especially of those whose stomach can't tolerate the milk. Female, it aids the menstrual discharge, helps the uterine contraction, and as we all know, when the locally applied of the mouth of the uterus, it is known as the abortification. We can use the carica papaya medicine in the mother tincture 1x and 3x, which is in the trituration form. Other symptoms. As we all know that already seen fevers with the enlarged spleen and the liver in the dysfunction, dysphagia, and other concomitant symptoms, that is the many times of stool, pain in the hepatic region, and other complication of the liver. Along with that, conjunctiva is yellow, tongue is white-coated, intolerance of the milk. Even the small quantity causes the pain in the liver and spleen and produces the indigestion to the patient. Now, let's discuss a case of the carica papaya. 30-year-old male came with the complaint of the dengue fever with a low platelet count. The patient suffering from the high-grade fever from the past 2 days, and the CBC shows the low platelets count. Along with that fever, there is a persistent nausea and vomiting with the loss of appetite. The patient given the carica papaya Q 10 drops twice a day, along with the advice of the excessive water intake and the soft diet, is he is suffering from the nausea and vomiting. And to promote the platelet count, I have given the carica papaya mother tincture 10 drops twice a day to increase the platelet count. The case is well improved with this remedy. As we all know, there is a specific action of the carica papaya in the increasing of the platelet counts, that the dengue fever is decreasing the platelet counts. So, carica papaya works wonderfully in this case. Within 3 days, there is a high rise in the platelet count, and there is a no nausea and no vomiting. As we all know, the carica papaya is also covered the dyspepsia. So, the carica papaya medicine works wonderfully in this case. Now let's discuss the another remedy, Casia alata. Casia alata, that is also known as the ringworm shrub. That is the Dadmurdan in the Hindi and Dragogan in the Sanskrit. Leguminous is a family. Casia alata is also known as the ringworm medicine because it is very effective in the fungicidal property. Favors and the other mycos, impetigo, syphilis, sores, psoriasis, herpes, eczema, rash, and itch. Any kind of skin complaint, the Casia alata works wonderfully. It has shown antibacterial activity against a wide range of the bacteria. Besides the skin disease, it is also used to treat a wide range of stomach problems, fever, asthma. Also, with the skin complaint, it is known as the antibacterial, along with that snake bite and the venereal disease. Casia alata, we use Casia alata as a mother tincture. Garcinia gambosia. All the homeopaths might know this medicine, Garcinia gambosia. The common name of the Garcinia gambosia is the Malabar termite. Gummy guti is also known as the Garcinia gambosia. This small fruit reminiscent of a pumpkin in appearance is currently most popularly used and widely advertised as a weight loss supplements. As we all know, Garcinia gambosia is the weight loss supplements. Garcinia gambosia is a popular weight loss supplement. People say it blocks your body's ability to make a fat and puts the brake on your appetite. Loss of appetite is a symptom, and along with that, there is a no formation of the fat. It could help to keep blood sugar and cholesterol level in a check too. Garcinia cambogia may take it easier for your body to use the glucose, that sugar your cells need for the energy. That's the another reason besides the weight loss, the people with the diabetes are interested in it. Along with the weight loss management, it is also effective in the diabetes management. We all know the Gymnema, Cesium, these are the diabetic medicines as a mother tincture homeopath use, but Garcinia cambogia is one of them. Why the Garcinia cambogia is one of them? Because there is a easier to body use the glucose, the sugar level of the need for the energy. The another reason for the weight loss, diabetes malnutrition patients need. Some researchers found that Garcinia cambogia can also improve the cholesterol levels, lowering the triglyceride and the bad cholesterol and the rising the high density, the good cholesterol. Studies have shown that the extract as well as the HCA, a main organic acid component of the fruit rind, exhibited anti-obesity activity, including the reduce of the food intake and the body fat gained by the regulation of the serotonin levels and related to the satiety. What the Garcinia will cause? The Garcinia give the brain stimulation, that satiety feeling, fullness of stomach feeling, that produces the loss of intake of the food. So there is a feeling of the satiety and the person cannot take the much more food, or the excessive voracious appetite will reduce and the food intake will reduce. Increase the fat oxidation and decrease the novel lipogenesis. HC is a protein inhibitor, a catalyst for the conversion process of a citrate to acetylate coenzyme, which plays a key role in the fatty acid, cholesterol, and triglyceride synthesis. The crude extractor or constitution from the plant also extract the hypolipidemic, anti-diabetic, anti-inflammatory, anti-cancer, and hepatoprotective activities in vitro and in vivo models. The use of this drug in the homeopathic has been confined to its action to the alimentary tract. As we all know, it mainly acts on the GI tract. From its pathogenesis, it is very evident that it is an intense and definite action upon the GI tract. Great irritability of the stomach, tenderness in the epigastrium, rubbling and rolling in the stomach, pain and distension of the abdomen, dysentery with the retained skybala with the pain in the sacral region, dysentery with the retained skybala, that is retained stool with the pain in the sacral region, profuse watery diarrhea in the hot weather, in the old people. Then we can also think of the Garcinia cambogia in the sun diarrhea. When the excessive sun causing the diarrhea, profuse watery diarrhea in the hot weather in the old people, then we can use of the Garcinia cambogia. 3x to 30C. We can use this medicine to 3C to 30C. Now let's discuss the case of the Garcinia cambogia. 32-year-old male came with the complaint of the obesity, along with that the high rise of the cholesterol level, having the weight of the 78 kg and 5 feet 8 inch height. The person here have been given the diet chart along with some moderate kind of exercise and along with the Garcinia mother tincture. Garcinia mother tincture 10 drops twice a day, in the morning and in the evening in the half cup of the water with the moderate exercise. Result in the 2 months, the person weight reduced with the diet along with the exercise and the controlling of the food with the loss of appetite. The person from the 78 kilogram reduces to 66 kilogram. The main thing of the person is that he had a very craving of much junk food, which reduced by this medicine, as this medicine causing the feeling of the satiety, the feeling of the loss of the appetite, the feeling of the fullness. This medicine works tremendous in this case. The person weight within the 2 months reduced down to 66 kg. Now let's discuss the very wonderful remedy, Justitia Adhatoda. As we all know, the Justitia Adhatoda given the tremendous results in the COVID-19. Okay, because the main symptom of the Justitia Adhatoda is the loss of smell and the loss of smell and loss of taste, which is the main symptom of the COVID-19. The common name of the Justitia Adhatoda is a Vasaka, the also known as the Malabar nut. The Arusha is the second name. The very first prover of the Justitia Adatoda is Dr. S.C. Ghosh, the natural order of the acanthaceae. What is the Ayurvedic use? The homeopathic use of the Justitia Adatoda is the wonderful and tremendous, as well as the Ayurvedic use of the Justitia Adatoda is a tremendous. Justitia Adatoda is well-known remedy as the old sort of the cough and cold amongst the Ayurvedic physician in the India. The Ayurvedic physician prize is a very much. They are very sure its efficacy that they call is a Vaidya Mata. That is the mother of the physicians. They call this drug as a Vaidya Mata because it cures all the kind of the coughs and cold. In the Ayurvedic doctors, also this medicine is a very popular and very famous. The patient suffering from the spitting of the blood, thesis, common cough, and the cold need not desperate, the physician confidently proclaimed that no death can take place from the cough of any kind if Vasaka can play its role and find time to display its healing property. In the Ayurveda, they say that if Vasaka is given, that is Justitia Adatoda is given to any patient suffering from the any kind of the respiratory disease condition, then there is a no death can be of that patient from the particular disease condition suffering from the specific respiratory disorder. If this medicine Vasaka, that is Justitia Adatoda, is given to the patient timely. Now, what are the clinical importance to us as a homeopathic doctors? Excellent remedy in all sort of cough, any kind of cough, any kind of cold, any kind of sneezing, any kind of nasal discharge, any kind of coughing, breathing difficulties. The Justitia Adatoda gives the tremendous results. It is proclaimed that no death can take place from the cough if the Vasaka can less place is a healing properties. Fits of the sneezing with the lacrimation and the loss of smell and taste. It also gives very wonderful result in the allergy kind of rhinitis, fits of the sneezing, excessive sneezing, 15-20 sneezing, with the lacrimation and the loss of smell and the loss of taste. Cough with the tightness of the chest as if it would burst and obstruction of the breath and sneezing. Along with that, there is a dry tongue with the excessive thirst of cold water is a key feature of this Justitia Adatoda medicine. What are the respiratory symptoms? Constructive type of pain in the lungs, tightness across the chest, whole body trembling while coughing with the hemoptysis, shortness of the breathing. Expectoration is a very yellowish, dry, and rusty. Patient get worse while lying on the left side. Lung affection attended with the fever and cough. As we all know, the COVID-19, the lung affection with the high-grade fever and the coughing, severe coughing. Hoarseness, the patient can't endure closed and warm room. These modalities like the pulsatilla, patient cannot endure the very closed and very warm room. Along with that fever, chilly every evening with the night sweat, also useful in the lung affection attended with the cough and hectic fever. We can use this remedy in 3x, 6x, 30 potency. Now let's talk about the Justitia Adatoda in COVID-19. Justitia Adatoda leaves extract is a strong remedy for the COVID-19 case report analysis. It is observed that antisonin vasocolin of the Justitia Adatoda are the good inhibitors. For the precaution, Justitia Adatoda leaves may be boiled with the fresh water and its vapor may be inhaled while the extract may be drunk after the proper filtration as a hot, healthy drink. Now let's discuss the case of this Justitia Adatoda. 28-year-old female came with a complaint of the coughing, loss of smell and taste. Breathing is a stertorous. Along with that, there is a severe coughing and having the yellowishness of the sputa. Given the Justitia Adatoda 3x in the TDS, morning, noon, and the night. By the next morning, the smell and taste is improved slightly. The patient said that I have some kind of taste. Cough is still present. The repeated dose further still 2 days. After 3 days, there is a complete recovery, no coughing. The smell and taste is regained. There is no breathing difficulties. There is no smuta and there is no coughing in that patient. Okay. Now the next wonderful remedy is the Rauwolfia serpentea. The natural order is the Sarpagandha Chandra, the doctrine of signature. Why it is called as the Rauwolfia serpentina? So the drug appeared as the serp, that is serpentine. So it is also known as the Rauwolfia serpentina. The roots of the Rauwolfia serpentina resembled with the snake. Thus, in ancient Indian medicine, it was used to treat a snake bite and hence named as a snake root. The other common name of the Rauwolfia serpentina is the snake root. Now let's dive into the history of the Rauwolfia serpentina. The Indian physician Rustam Jal Vakil is considered to respond to introduce of the Rauwolfia to the Western medicine. He collected the patient treated with the Rauwolfia for the 10 years from the 1939 to the 1949. In the 1949, he published a watershed paper on the anti-hypertensive properties of the Rauwolfia serpentina in the British Medical Journal. He presented with the detailed result of treating with the 50 patients who had high blood pressure with the root of the Rauwolfia. Results were remarkable and significant. The Rauwolfia serpentina contains a number of bioactive chemicals, including the sunpatenin. Snakeroot depletes the catecholamine and serotonin from the nerves in the CNS. It was reported to the Mahatma Gandhi took it as a tranquilizer during his lifetime. A compound which it contained called desiprin is used to treat a high blood pressure and the mental disorder, including the schizophrenia. The Rauwolfia serpentina Q. The clinical. The Rauwolfia serpentina Q, as we all know, the Rauwolfia mother tincture is very useful in the case of the high blood pressure. Along with that, in the cases of the violent maniacal symptoms, fever during the puerperium stage, in the high blood pressure without the marked erythromatic changes in the vessels, it also acts as the sedative. In the irritated condition of the central nervous system, and along with that in the mind, in the cases of the insanity, the Rauwolfia serpentina is a very useful medicine. Now let's discuss a case of the Rauwolfia. 33-year-old male came with the complaint of the high blood pressure in the OPD in the morning with 190 by 110 millimeter of the Hg. Given the Rauwolfia Q drops in the half cup of the water every 1 hour under the observation and the monitoring of the BP 1 hourly. By the time of the afternoon, BP came down to 110 by 70 mm of the Hg. Rauwolfia is the very effective in the high blood pressure. So it will lower down the high blood pressure and gives the tremendous results in the cases of the hypertension. As we seen in this case, in the OPD, the morning blood pressure of the person, the male person, is 190 by 110, and the which came by the time of the afternoon 4 p.m. that is 110 by 70 milligram of the mercury. Now the very useful remedy which we Indian used in our household also, the turmeric, the kari jiri, all these medicines, tulsi, all these medicines we also use in the Indian home kitchen. The common name of the Veronia antihelminthica is the somraja, that is kari jiri or the kadvu jiri. Why it is called as a kali jiri or a kadvu jiri? Because it looks like a jiru or a jiri, or it tastes like a very bitter in a taste. That's why it is a kadvo or a very kali. The natural order of the this remedy is a comprate remedy. As we all know, the kari jiri in the empirical use or traditional use of the kari jiri is to cure the worms in the child. Okay, as in the homeopathy, we also known as a in the Veronica antihelminthica or the somraja, the karijiri is the name suggests, antihelminthica, that is a worm curing medicine. What are the clinicals of the karijiri? It has been remarkable anti-helminthic property, however, distinctly effect in the threadworms infection. We all know the Sina is very effective in a Ascarid lumbricoids type of worm infestation. But if there is a threadworm infections, we can use this Karijiri in the case. It is also useful in the trouble arises in the consequences of the worms infestation, that is a nocturnal enuresis, grinding of the teeth at the night. It is a very resembling medicine with the Sina. But if there is a infection of the threadworm, then we can give the Karijiri, and if there is an infection of the Ascarid lumbricoids worm, we can give the Sina medicine. We can use this medicine as a mother tincture or a 3x potency up to the choice of the physician. Now, the very important medicine that is a Cesium jambolinum or a Eugenia jambolanum. The common name of this medicine is a Kala Jambu or a Jambodo or a Jamon. As we all know that this Cesium or a Kala Jam is very useful medicine for the diabetes mellitus. The grinding of this particular fruit, also the given preparation in the Ayurveda to control the diabetes mellitus. Diabetes mellitus as well as the insipidus, prickly heat, that is the urticaria, prickly heat, pimples, any kind of the itch, emaciation, and the weakness. Much thirst with the profuse flow of urine in every 1 or 2 hours. There is no other remedy cause is so marked degree in the diminution and the disappearance of the sugar in the urine. If there is a presence of the sugar in the urine, that is the diabetes, then we can give this medicine. It will work the tremendous. Skin. Prickly heat in the upper part of the body, small red pimples which itched violently, old ulcers in the skin, diabetic ulcers of the skin, probably of the diabetic foundation. As we all know, the complication of the diabetes mellitus is the diabetic ulcer. So it will work tremendous in the diabetic patient. Along with that, the diabetic ulcers, the complications of the diabetics, it also effective in the old ulcers of the skin as well as the diabetic ulcers of the skin. Much thirst, very excessive thirst, along with that polyuria is present, profuse flow of the urine. Along with that, in the urine there is a sugar is present. So this medicine is given and there is a quick disappearance of the sugar in the urine. Now the other medicine of the Gymnema salvestri. The common name of the Gymnema is a gurmur. The Mesha stringa, the ram's horn, and the first prover of the Gymnema is Anand Chopra. The cesium, along with that Gymnema, are also very wonderful remedy for the diabetes mellitus. The first prover is the D.N. Chopra, the clinical sugar killer. As we all know, cesium is a very good remedy as a sugar killer, and the Gymnema is a very good medicine for the sugar killer. Excellent medicine for the diabetes mellitus, also efficacious in the poisonous snake bite. Now the urinary system. Profuse urination loaded with the sugar. After the passage of the wine, patient explained, this passing of the urine in the large quantity has made me very weak. The patient is to and fro. The patient will drink the water and the passes the urine. Drink the water and the passes the urine, like a pendulum. Diabetes patient, like a pendulum. The patient, he go to the water intake and passes the urine. The color of the urine is a very white in color. The quantity is a very profuse and specific gravity of the urine is a very high. Skin, burning in all over the body, the diabetic carbuncle is present. So we can also give, along with the cesium, we can also give the Gymnema medicine to the patient. Now the other medicine is the Syphilindrica indica. That is a telkucha or a mimba. The first prover of the Syphilindra indica is the Dr. S. Shigos. As we all know, it appeared as a Cucurbitaceae family. As we all know, Brownia belong to the Cucurbitaceae family. The common name of the Syphilindra indica is a telkucha. The clinical of the Syphilindra, diabetes mellitus as well as insipidus, skin affection, jaundice, and dropsical condition. Might disinclined to do any kind of work, very morose, very oversensitive, memory is partially gone. The giddiness worse after the passing of the urination. There is a burning of eyes, dryness of the mouth with the great thirst of the large quantity of the water at the time. As we all know, the diabetic symptom is that there is a very specific desire to drink water. There is a urine. Along with that, there is a very specific medicine. There is a symptom that dryness of the mouth, very excessive intake of the water, but still there is a dryness of mouth. Along with that, urine, profuse urination, weakness, exertion after the urination, and diabetes malnutrition. The pulse is very weak and intermittent. The stool is a greenish mucus tinged with the blood and pain before and after the passing of the stool. It can also given in the case of the dysentery. The potency of the choice is mother tincture, 2x and 3x. These are the references. I would like to add in the Garcinia gambogia, that is, it also cured the diarrhea, like a croton tick diarrhea, gunshot diarrhea. if there is a presence of the gunshot diarrhea and along with that there is an indigestion, then the Garcinia gambogia will affect very effectively in that case. Um, oh, sorry, but that's all for today's session. Any questions?
Yes, Dr. Neha Kathodia, it's really a very good session. You can cover some more medicines in the coming edition of your presentation. Really worthwhile session.
Thank you.
It is the time for discussion, and those who want to participate in the session may please raise your hand so that we can have a discussion on the subject. And Sridhara Kurbusal has already raised the hand. Sorry, Sepatan, from a retired Assistant Director from CCRH. So we can begin the session of discussion with T.N. Sridhara Kurbusal.
Madam, thank you very
Yes,
much.
sir.
Excellent presentation. Very good.
Thank you, sir.
But your speed was little sufficient
Fast.
time was there. You may next presentation. You please
Yes.
kindly, because some others are like to note all these things. So
Yes, yes.
I am not
I will.
noting. I am using all
Mm.
these things. But I have one question also. I can ask it.
Yes.
That the Rabotpia usually it is gives immediate relief, but it must not use continuously. It is telling about something about that. Are you able to explain?
Raufolfia, I used Raufolfia as a temporary relief to that patient, which came into the OPD 190 by 110 milligram of the Hg. So to the temporary relief of that patient, I used Raufolfia as a mother tincture to prescribe to a particular patient.
My question is, it is continuously using, some problems are coming, it is telling. How you feel? That is my question. You can tell, then it is all right. Otherwise, you cannot tell. All right.
But
I will not use continuous because if there is a continuous problem, then
Okay.
Mm, mm,
Okay, thank you very much. Come again
yes,
with more these things. You must reduce that then, so others
yes, speed, yes,
can
sir.
your speed is little high. Thank you very much.
Yes, sir. I will keep that in mind.
There are many people who are using this for more than 30 to 40 years, but still there is having no complication for them. So homeopathic medicines will not make so much of problem to the patient unless otherwise we uh, continue the same without giving so much of drops. 10 drops will not do any harm, whether you take it for 2 times or 3 times or 4 times a day. But if you take some 50 drops per TDS, that may do harm. Otherwise, it will not do harm. So, no need of worry about all those things. I know some patients who are taking, not only before my practice also they were taking, even now they are taking. And I won't ask them to stop, because there is a belief in the mind that, oh, this is the medicine that protect me from my heart complaints and my pressure. Now I'm feeling better. So they may gradually reduce the drops of the medicine. The knowing these homeopathic medicines from Indian medicine is a very good subject, because people are always running behind these bachelor remedies and like that. But we have with us a lot of homeopathic medicines. Then why can't you use all these things in a proper way? That is the question. And now I invite Dr. Ramprasad sir. You can also add something more on that, because he is a person as a button or another button.
Thank you, Dr. Dhanesh ji, and everyone. Namaskar and congratulations, Dr. Neha Kothadiya, madam.
Thank you, sir.
Very nice presentation, excellent session. This mother tincture, Indian mother tincture. beautiful describe the any mother tincture, hemorrhagic and other hypertension. Mother tincture is a treatment of homeopathy the only palliative point of view, and a structural change and pathological change give the mother tincture frequency, not curative point of view. Main cause of disease according to law of homeopathic science invisible, dynamic. So mother tincture, palliative point of view, treatment, very nice. Describe the Indian mother tincture. Blomia odorata, hemorrhagic and piles, Indian drugs, Blomia odorata. Very good drug, piles and hemorrhagic medicine. हिंदी में बोला जाता है उसको कुकरौंधा, कुकरौंधा। हाँ, तो मेरे क्लिनिक के सामने भी लगाए हुए हैं, जिम्मा से ले बेचता हम पेड़े लगाए हुए पूरा, और कुकरौंधा भी लगाए हुए हैं। तो वेरी नाइस प्रेजेंटेशन, एक्सीलेंट सेशन, थैंक यू नेहा कोथादिया।
Thank you, sir.
Yes, Dr. Neha, you have mentioned about the Carica papaya and its uses. Really, it's a very good remedy in dengue cases.
Thank you, sir.
Not only in dengue cases, wherever there is a reduction of blood cells, one of the most important aspects is that one has to maintain the platelet count in a good way, because they are the precursors for these white blood cells. And as the number of platelets count reduces, the patient's defensive mechanism will also worsen. So the primary purpose of the treatment is to maximum number of platelets. So in those conditions where platelets count is getting down and down, when you give some few drops of this Carica papaya tincture frequently, that will definitely increases the platelets count in a short time. Thereby, we can save the patient in a good way, as early as possible. So also, you have to give the concentration medicine along with that. That will definitely
Yes.
improve. We have seen a lot of cases. A lot of people uses Carica papaya leaves directly, and they just take these leaves and then boil it in water, and they ask them to take this water every frequently. That will also give some kind of improvement in those conditions. Am I right?
Yes, sir. Yes.
Yes, sir. Then
The patient mistake that the leaves extract not the very same day. He will extract the juice and store in the freeze. That will retrograde her or his health.
yes. Then what is the present situation in Gujarat? Whether if you are getting a lot of the dengue cases and
Sorry, sir.
whether if you are getting a lot of dengue cases in your clinic.
Yes, dengue and chikungunya cases very
Yes.
frequent.
Yes,
Chikungunya as well as the dengue fevers. The chikungunya is a very abundant in this winter. Chikungunya pains, post pain, post arthritic pain of the chikungunya.
Which are the medicines people have found suitable for the chikungunya?
In the cases of the chikungunya, from the modalities, the brownia works very well. Even though the chininum sells very well, Actia racemosa works very well along with the rustox. I have seen from my past cases, these 4 to 5 medicines works very tremendous and wonderful result in the cases of the chikungunya.
So exactly, you petroleum perfoliate also gives results, because it affects almost all joints, and arsenic amalgam, strokes.
Yes.
All
Yes,
these
yes.
things are very good in different. As well as whether you people give any tinctures for this chikungunya?
No, I usually prefer the constitutional as the patient say all
Yes.
the kind of symptomatology and the very specific emphasis on the chikungunya patient, the modalities.
Whether you will allow to take some biochemic medicine for this kind of pain, because the pain and all those pains, like calcaria force might force combination with sometimes paraforce is a very good remedy in both at the beginning stage of.
Yes, in the beginning stage, it will reduce the, but obvious first reduces the fever and first reduces the bone pain. Surely it will act.
There's a question in the chat box. Dr. Ruturaj, what should be the potency of Perrier papaya
In the
anorexia?
cases of the anorexia, in the cases of the anorexia, we can use the 3x, 6x, or 30C. Is the patient susceptibility and the other symptoms of the patient?
Yes. If anybody has any question, you can come over here and raise your hand so that we can talk to Dr. Neha Kothadiya. Yes. What is the present climate in your place? Whether it is extremely chilly or hot?
No, extremely hot. Right now it is extremely hot, very hot, 42, 43 degrees.
Summer has already.
Yes, summer has, yes.
Oh, so even then the mosquitoes are growing, anything like.
Yes, mosquito is very,
But
and the, yes, chikungunya cases and the malarial cases are risen from past week.
okay. What what about your college? Whether the number of students?
Yes, right now exam is ongoing.
What about
uh,
the strength of your college? 100.
100.
All
Yes, UG and PG. We have 3 batches of the PG and for first to final year 4 year and 106.
Rituraj, you can directly come over here and talk to. I shall ask. Yes, please unmute yourself, Dr. Rituraj. You can ask the question directly. Please unmute. You have mentioned some questions in the chat box. Not responding.
Is it safe in the old heart patients? I mean, do it increase the platelet in that case also?
There are some questions. Is it safe in all of the patients to increase the platelets? What should we know? Is it safe in all heart patients? I mean,
if it is a case of the dengue fever, then yes, with precaution, we can use the Kirkia papaya.
if the patient is safe in if he is having some heart problem also, we can give them right remedy along with the Karika papaya. There is no problem. That's what may be the question. Then what kind of support the government you people are getting in the from Gujarat government for whether you people have a lot of government dispensaries every village. Here in Kerala, we have government dispensaries in every panchayat.
Oh, nice.
And we have more than 40 hospitals with more than 20 beds each, and it's a condition.
Okay. In Gujarat, there is a Ayush doctor in the PHC and CHC, but there is no such a specific homeopathy practice in the PHC and CHC.
It is a high time that you people will come can unite together and work for asking for these government hospital dispensaries. Just like what you can ask the health minister to come over Kerala and to see how it works in Kerala, and you can give a memorandum like that. That's homeopathy can be built because I heard that there are 40 homeopathic medical colleges in Gujarat. Am I right?
Yes, you are right. And Maharashtra and Gujarat has the highest number of the number of the colleges in the homeopathy.
Then that means nearly 4,000 doctors are coming out every year. So,
Yes.
so we need to take note of this, all these people together work for that. There are a lot of homeopathy believers in the Ministry of Gujarat government.
Yes.
I don't know why people are not taking such a big way. Because which organization is working there for people? IHMA, HMAI, like that. Is there any specific organization working for building up homeopathic doctors together, bringing up?
So I have no idea about that, sir.
That's
Sorry.
the situation. But here in Kerala, there is a lot of, there are three main organizations which are working. Not at the IFPH, but the doctors are only. We have a lot of homeopathy lovers also in this forum. But there are institution of homeopathy Kerala, which is the biggest one in Kerala, organization in Kerala. The second one is IHMA, that is also having very good number of both the then QFA, that is qualified private practitioners group. All these organizations are making present seminars every 3 months, 3 months. So we are inviting ministers and chief ministers, something like that, so that they give us more hope and chances to propagate homeopathy. So
Good.
it's time to motivate your students for all these things.
Yes.
Students can make a big change in that way.
Yes.
Anyway, I invite, it is a time for wind up the session. I invite Dr. Rambaresh sir to say what the thanks to the session also.
Thank you, Dr. Dhaneji, and thank you, Dr. Neha Kothadiya ji. Very nice presentation, excellent session. Behalf of
Thank you,
whole team, IFPH, very thanks. Again, presentation. Thank you, very nice.
Thank you. Thank you so much. And sorry for early ending of session.
No problem. You have done the presentation in a beautiful way, and we can have the second part of the same very shortly as per your convenience, because there are a lot of medicine in that category.
Yes.
So you can come up with some 4 to 5 or 6 remedies for the next presentation.
Sure. I will. I will have my back session.
We're waiting for that. Okay. Thank you, Dr. NEHA KOTHADIYA and Rambaresh sir, and those who attend the session. I hope all of you will be joining us tomorrow at the same thing. We will have another session from a new personality that, no, she has done. With the Pavitra Go will be the guest tomorrow. All of you will join us. Thank you all. Good night.
Thank you.
It's over to Dr. P. Shaila to moderate the Malayalam session.